I was at the University of Florida, and one of the first patients I saw was a young woman who was in law school at the University of Florida. And when I saw her, I diagnosed with optic neuritis, and I was really proud of myself, and I thought I did a great job. And I told her, at the time that optic neuritis is associated with multiple sclerosis, and we're going to check to see if you have MS, and I'll see you back tomorrow, and then we'll talk about it. And that night when she was getting their MRI, I happened to be working late, and I went into the control room where the technician was doing the MRI, and as my patient was walking out, I was able to look at the MRI, and it was clear that she had multiple sclerosis, and she wasn't aware of it. So I stopped her in the hallway before she went home, and I thought, you know what, let me let her know what the plan is for tomorrow, and I'll tell her what the MRI shows. And so I told her, and she came back the next day, and we got her admitted to the hospital, gave her steroids, and then she was seeing the neurologist, and everything went fine. I used to see her on a regular basis, and she was graduating law school, and she was leaving, and we had our final lunch to say goodbye because we became friends. And she asked me during the lunch if I remembered the day that I told her she had MS, and I told her I did, and she says, do you know what I did when you told me I had MS? When you told me I had MS, she says, I cried, and I cried all night. When I saw her the next day, I never saw a tear in her eyes. And that's when I realized that, the things that you say to somebody as a physician can really have an effect on somebody's life. It was sort of a wake-up call to me as a physician. Being young, you're just taught how to take care of diseases. And what she taught me, and it was only later that I found this wonderful quote, which says that a good physician treats the disease, a great physician treats the patient who has the disease. And what you realize as you get older is that there are people behind the disease. And I have two younger sisters. So I thought to myself, if it was, God forbid, it was my younger sister, I'd want a physician who would want to be compassionate and care about somebody. And as a result of it, I was involved in multiple clinical trials in optic neuritis. I find the disease very fascinating. It's unfortunately a disease that affects mostly young women. So they're in the prime of their life. They're blindsided. It breaks my heart every time I have to tell a young woman who comes in thinking they just have a little vision problem, it's a contact lens, that it's MS, because it's a devastating sort of change in their life. But the good news is, and as I've seen countless times, they get over the hurdle and they do very well. And prior to 1993, we had no drugs, and now we have some amazing medications that really, and now we have oral drugs that have really made a big difference in the way MS affects people. It's really been amazing. And I think of all neurological diseases, I can't think of a disease like multiple sclerosis where there's been so much advancement in both our understanding of the disease and our treatment of the disease in such a short period of time. It's been amazing in the last couple of decades, the advancements we've made in MS. So that's the story, and that's why I'm here. And that's why I have the passion that I have for optic neuritis and patients with MS.